Welcome to iDryNeedle to the Point. Today we invite guest Lindsey Hughey of South College DPT and ICE Physio to discuss dry needling and education. Welcome back, folks. This is iDryNeedle to the Point. I'm your host, Paul Kaloran. And technically, if you're following us, I guess throughout the seasons we've had so far, this is our 19th episode, which it's crazy to see kind of the accumulation once we jumped on Spotify and iTunes. There's people out there listening, which is amazing to me. It's very humbling. So episode 19, but really we're in the middle of kind of our 2021 summer series. And this is the fourth episode of that. We have another incredible guest. Honestly, we've been trying to get Lindsey on since the first season. One of the busiest people I know. And if my introduction doesn't speak to how busy she is, if you haven't heard of Lindsey Hughey, not only is she a PT, DPT, she's OCS board certified. She's a FAAOMPT fellow. She's also core faculty at South College DPT, and we'll talk about that because one of her primary roles there is advanced interventions. And it's fascinating for me to hear, even at conferences, what the student exposure is to interventions these days, which obviously includes dry needling. Aside from that, she's also a lead faculty with ICE, so the Institute of Clinical Excellence, primarily the upper extremity management course. So we'll also touch on that. And if that's not enough, she's pursuing her DSC. Beyond that, she does have a private cash pay concierge practice. So she's one of those very ambitious academics, but also keeps her feet firmly in the clinic. And that's drivept.co is the website. But you can see all of that on Instagram at LT Hughey is her last name, Hughey. And I'll fully admit that for the first year I followed you on Instagram, I just put a phantom L in there and I thought it was Lindsey Hughey forever, but it's Hughey. So Lindsey, thank you so much for joining us. Anything else you'd like to add? Say hi to the audience.
Well, thank you so much for having me, Paul. It's an honor to be the 19th episode. Congrats on so much success with this. I love the to the point and the humor associated with that. I'm always up for a corny dad joke. So thanks for that. And I appreciate the opportunity and that humbling introduction.
Well, thank you. And yeah, most of the humor of To the Point, aside from it being a dry needling podcast, is any of you that have been on a course with me or heard me speak, brevity is never something associated with me. So the To the Point is funny because rarely do I keep it succinct, but that is the goal.
Well, Paul, this should be a funny episode because I tend to be a little verbose myself.
That's excellent. I should get an egg timer out so that it bings when it...
Let's make it like an EMOM for the clinician.
Exactly. That would be a great template. But let's dive in. With that introduction, I do want to give you the floor. And I ask almost every guest on here, they're a rehab professional of some sort. So I always ask kind of what got you into PT or what got you interested in becoming a rehab professional. But because we're also going to get into some of your academic roles, let's take it a step further. And what got you into kind of the education or the academic side of physical therapy?
Well, becoming a PT was actually because I fractured my fifth digit. So I was playing volleyball and thought it was jammed. And so we just did the tough thing. My mom said, tape it up. And about a month later, it was still, black and blue and not doing well. And I couldn't bend it. And so I was actually prescribed PT for that fifth digit. Or I could have done surgery, but I opted for conservative management. And while it looks funny, I can bend and move that fifth digit well. And so this kind of changed my trajectory of my professional career. I thought I wanted to be a teacher, an English or history teacher. And then I got into that clinic and I was like, I love this vibe. I love working with humans. And I never wanted to be behind a desk. And I really realized that you're teaching your patient every day about how to help themselves. And I really loved science too. So it was just a very clear picture that PT was the way to go. So my junior year of high school, I realized that and changed trajectory completely.
the pinky. I mean, I could totally see you as an English teacher, just your diction and your well-spokenness. But at least you're putting it to good use on the rehab side. And that's what led you into the academic side of rehab as well.
Yes. So it's funny, academia kind of came about gradually. So I pursued fellowship training probably about 2 years out of school. That actually wasn't my original intent. I was going to go for my OCS, but Dr. Julie Whitman, she just said, if you think you're going to go fellowship eventually, we have this track through evidence in motion where you can just dive right in. And then it also helps facilitate and mentor you up to be a teacher and an instructor. And so that really appealed to me in fine tuning and sharpening my skills of not only manipulation, but in teaching and clinical reasoning. And so once I graduated fellowship, there was an opportunity from Dr. Tim Flynn to help with MSK3 at South in 2017. And, I kind of haven't looked back since then. Really loved the environment. The hybrid learning environment's amazing. It's electric when all the faculty are together, and you really not only work with amazing motivated students, because it really caters to a student that is highly motivated. To fit 3 years of a doctorate level education to do, it's astounding. I don't think I could have done it when I was entering PT school. So these students are motivated, and then the faculty, you're working with renowned faculty from across the United States, and you all come together, and it really makes you be a better teacher. It holds you accountable to being the best instructor that you can be, and an opportunity to give one another feedback in your teaching and learning practices. And so in the last year, I took a part-time core faculty position at South with their second January cohort. And it's been a blast and an honor throughout.
And I know you're just coming off one of those. I mean, it was an intense, not just week, 2 weeks.
Yes.
And we're going to get into that. And I agree. I mean, we were talking offline before this of how impressive the faculty that you or that South has assembled is highly impressive. And I do want to get into that. But before we get into that, because I think it's going to connect a few dots, I'll add my little dry needling infusion and just ask, again, I ask most of our guests this question, but what was kind of your initial exposure to needling? And then where does it kind of currently fit in your practice?
Thank you for that question, because I love dry needling. First exposure to dry needling was kind of intermittent through my evidence in motion fellowship, seeing some of the fellowship grads needling. It wasn't directly embedded in our curriculum, but like seeing some of our leaders like Andrew Bennett make really powerful changes using dry needling, and then like kind of meeting Ado. And it just made me yearn for that. And actually, one of my fellowship fellow colleague graduates that graduated like 6 months before, Dr. Chris Myers, who actually is faculty at South now, she was working for Benchmark at the time and doing their dry needling courses. And so I actually took my first 2 dry needling courses after I graduated fellowship from her. And it was a great experience. And ever since I've incorporated that into my practice, it's been about 3+ years now that I've been dry needling. I've just seen immense changes, very powerful changes in myofascial just length tension, how that direct response to tenderness palpation and tautness of the band. I haven't seen any other soft tissue technique achieve those powerful results like dry needling. And then in addition, just overall activation and improvement in pain and function.
That's awesome. It's interesting. It's probably a topic for another day, but what's interesting is I've had discussions with other very high level fellowship trained manual therapists. And I mean, maybe some of these conversations were 5 to 10 years ago.
Mm-hmm.
But dry needling seemed to be very divisive in that arena. I mean, people either had the direct experience or at least were intrigued enough empirically to put it in their practice, or kind of went the other direction with it and just it didn't have the research basis. To some degree, it kind of combated some of the theories of just the articular system and the input we give with manual therapy. But again, probably a topic for another day, but I like hearing your perspective because you do have those those high level, those fellowship manual therapy skills. It's interesting to hear your take or your perspective on needling.
And I would say like Ado presenting at Manipalooza and seeing him teach at various Manipaloozas just really changed my ideology of the neuromuscular system, because I was very joint based coming out of evidence and motions fellowship, that would help restore the neuromuscular system, that I didn't really have to pay much attention to the soft tissue structures, but our epidermis is our largest organ, right? And there's so much, there's just great effects that I've seen with dry needling. And I will say that conversations with Ado and his presentations have really helped change my mindset. And you, Paul, too, courses that I've been with you have been really helpful in changing how I think about dry needling.
Well, that's flattering. Thanks for that. And it's interesting because I didn't go through the fellowship, but I didn't know we ran in such similar circles, because I am a Regis DPT grad, and a lot of the allure, my attraction to Regis was the Tim Flynn, Julie Whitman program of manual therapy that lured me out. I mean, from Wisconsin to Denver, Colorado, didn't take a lot of persuasion, but that was my main impetus to attain my DPT at Regis. And then even a step further, I didn't go through the fellowship, but I did go straight into iDryNeedle, which is also very articular, very Maitland-based graded joint mob and manip. So people have heard my spiel before, but it's interesting because it's similar to yours. It's needling at first was just intrigue to me, but it did put like this anatomical or this neuromyofascial layer on everything else I was doing in the clinic. And I think that's the great connecting the dots, like I said, is you do teach your core faculty at South DPT. So first of all, you mentioned that is a highly ambitious, it's a highly innovative educational model for DPT. It's that hybrid setup. You personally run the advanced interventions, which brings my questions. First of all, you and I are having this discussion of kind of what we went through, and even, let's say, the interventions that we were exposed to in PT school. So the first question is, especially you being in the innovative model, the innovative kind of pioneering setting of South DPT, what is a South College student PT's intervention exposure? Like, what are they learning now compared to what maybe you and I learned? And I guess specifically on needling, what is the interest level out there? Prospective PTs, are they asking about needling? Are they uninterested? Do they see it as kind of a next level? What's the climate of needling with SPTs these days?
Great questions. And I'm going to do my best to answer both of those. And if I miss any parts of them, please chime in and give me a cue. But first, advanced interventions, this is my first year being primary. I've been a part of the course for the last 4 as secondary and adjunct. And so this has been a really unique and amazing opportunity that, along with Dr. Justin Dunaway, to revamp this course. And so this is a course where we're doing advanced, not only spinal, but extremity manipulation. We're also teaching functional fitness. So how to look at movement, multi-segmental joint movement, and coach movement. Also pain science intervention like laterality training, mirror box training, really practically applying those interventions and learning what patient population they're appropriate for based on a patient's irritability, and a really good subjective examination. In addition, dry needling is really one of the highlights. And I'll say what actually draws a lot of students to our program is that we are willing to teach dry needling where a lot of programs aren't. They kind of say that's something that you can do after school and that it's not an entry-level skill. And so we take another approach that we believe this is tools that you should learn about at entry level. And then, yes, further learn and grow and refine them. But this is a tool that has really amazing effects. And all the tools I listed, they're just one piece, right? We have to do a really good job in our subjective examination, building that rapport with our patient, understanding their goals and their irritability. And then that helps us fine tune our objective exam to make an objective exam that's for Sally, not a me, or Jared, not a shoulder eval. So in advanced interventions, we really challenge them to create a framework that's individualized and patient specific, and then how to use those tools to create windows of time to then treat that patient in a way that helps meet their goals faster. And so I do think South is doing something special and is very progressive in offering all of those things in advanced interventions.
Man, that sounds like it. I mean, I'm biased. Almost everything you listed is something I would have loved to be exposed to in PT school. And I know that there's CAPT credentialing criteria that kind of dictate what most schools expose you to. But man, trying to picture, I graduated in 2010, which is crazy. I just stopped calling myself a new grad like 2 years ago, and I'm 11 years out already. Like I'm seeing this new professional, like even ICE. I love how they're branding the PT 2.0, because really Jeff Moore came on that first season, and we just talked about how PT's changed. And a big part of that is the academic side. I mean, what students are interested in, but really what they're being trained in. And not to say that every skill that a student is interested in should be included in the program, but man, if you talk about the pain science side, the fitness forward side, that really creates a culture, but really a mindset of interventions that have impact, like you said, influence on the nervous system, that give you these windows of change. But man, if I would have come out of PT school with the loading, fitness forward, movement based mindset that I have now, I just feel like I would have been a much more effective clinician. And it seems like that's what you're molding at South.
And Paul, that's exactly, you kind of took the words right out of my mouth, and that we're creating the full package deal, and what ICE Physio calls physical therapy version 2.0. In fact, Justin and Jeff and I were kind of reflecting and laughing how we're kind of jealous of our own students, because to think that we could have graduated with those skills. And I too graduated in 2010, so 11-ish years now out and practicing, and just thinking about the weapons we all could have been if we had that, and just feeling grateful that we have the opportunity to pass that on to students. And I do think South really caters to a fitness forward mentality and brand those students that are coming to the program. That's the part they're craving and really wanting when they come to South. And they are super stoked about dry needling that part. Like most students say that's why they came to South.
Yeah, that's great. And at LT Hughey is yours, so you can get pulled over, but I think it's just at South DPT if you're on Instagram.
Yes.
Pretty active platform there as well if you want to see what they're doing, but truly innovative. I want to shift gears for a moment. We'll stick kind of on the fringes of education, but shift gears. I mentioned you're also lead faculty for ICE, primarily the upper extremity management course. So first of all, if we're saying we're shifting gears from the student PT to now licensed practicing PT out in the world, first tell us why every PT should take a management course like an upper extremity management. And then again, whether it fits or not, where would you see dry needling fitting in a course like that? Or you can even think of it vice versa. Say a PT who's already trained in needling, what's the value? Why does every PT need to take a course like the upper extremity management?
Thank you for the opportunity to talk about extremity management. Of course, I'm repping my ICE gear today.
I saw that.
It's one of my favorite jobs besides South College. But this course, it really takes your exercise dosage and prescription to the next level, and dives deep in providing a systematic framework for evaluating each extremity joint. So we actually offer upper and lower quarter all in one weekend. So it's a stacked weekend. The first day is all upper extremity evaluation and treatment progressions. And then day 2 is all lower extremity progressions. And so it's a really amazing course. Obviously I'm biased because I'm lead, but the systematic approach we go through with each joint and evaluation really allows you to free your mind to then focus on the human in front of you. And then while all along the way, learning what it means to be fitness forward in improving a human's ecosystem. So we really talk a lot about diet, hydration, protein intake, sleep, mindfulness, and that if you don't have that full package to offer, you're not going to be effectual or impactful to your patient. And of course, we learned some cool extremity manipulations and exercise for the entire upper and lower quarter along the way. And then in regards to dry needling is a powerful adjunct to modulate pain symptoms and then helping with that ecosystem regulation. I find it restores function more quickly, and I'm using it with majority of my patients that I'm treating out of a CrossFit box. But if you have a body, we're probably dry needling if there's some kind of pain and dysfunction on board. And it doesn't mean dry needling is used the entire bout of treatment, right? We're using it to create a window of opportunity to have less pain, to improve function more quickly, so you get to that load piece more efficiently.
I love that. And honestly, your course is on my personal, very long list of courses I would like to take. At this point, it's like a bucket list because trying to convince my wife one of my weekends where I'm not traveling to go take another course gets more challenging these days. But I have met a handful of the ICE faculty, and I have taken the online version of the CrossFit management, and top tier faculty, top tier content. I mean, if you want not even just the professionals out there that are truly the influencers and experts in what they're teaching, but I mean, you mentioned Jeff Moore, Justin Dunaway, who are also involved with South. I mean, if you just want those influencer, almost sounds like a pop culture word, but just like someone who gets you excited about the profession and where we're heading and what we can do in an individual patient's lives. I mean, that's what gets me most fired up. Why I love just all the interactions I've had with ICE is it pumps me up. Like I'm stoked every time I have a conversation or I see you guys at a conference. So I would highly recommend checking out Lindsey's course, but really the full ICE team. I don't think you'd be disappointed on any of their offerings.
Well, thank you for that high compliment. And you are on my list too. To be on a bucket list is very honorable. I feel special. Can't wait to have you at a course. And I will be coming to one of your functional dry needling courses as well. I can't wait.
Excellent. Well, might be a little nervous with you sitting in the room, but shifting gears one more time. I mean, you take pride in, again, I don't know when you sleep because you also have a family, but you take pride in the fact that you are all of this on the education and continuing education side, but never want to be that clinician that's fully out of the clinic. So you do have your concierge private pay practice. So first of all, tell us more about that, what Drive PT is and what the model you've created is, but also if there's other professionals out there, maybe even other professionals that are interested in doing, part-time something else. Maybe it's education, maybe it's not. Well, how would you describe your practice, but what would you tell other rehab professionals that are intrigued by this model of kind of part-time in the clinic, part-time with another specialty?
Such great questions. Thanks for the opportunity to talk about Drive PT. So after I graduated fellowship, I felt very challenged working in a large outpatient model where I was seeing 18 to 26 patients a day and really feeling like the model that I learned to treat and that would really create change, I wasn't able to give that one-on-one care for patients. So patients would come flared up and I would have like 2 or 3 patients at once, sometimes more, and feeling like I just wasn't doing right by the patient. And so, all along the way during fellowship and just treating in this large outpatient practice, patients would say, when are you going to open your own? And, I'd kind of laugh about it. And, it finally at the point where I was like, I need to do this. And people from my CrossFit box started coming to see me. So specifically at this outpatient clinic. And then I was giving them subpar care. And I was like, this isn't like my name, even though, I was under the umbrella of a large outpatient practice. I started feeling like I need to do something about this. And that was kind of the final catalyst. My CrossFit friends coming to see me and feeling like I can do this. And my CrossFit coach and head owner offering a space for me to work out of. And so it was very serendipitous that, I had that drive to do it, and which kind of leads into why I named Drive PT, just because I'm catering to a population that has to have the drive to get better. You're going to pay me cash, or you can also use your HSA or FSA, but you have to be a really driven individual to do things on your own time, that I'm going to be there to help you, but you have to be able to be willing to do your part. And, that my same internal drive kind of for excellence on all fronts of academia, treating, and as an individual CrossFit athlete is what kind of made Drive resonate with me. It's an intentionally part-time practice because I do have 3 kiddos, 11, almost 10-year-old and 4-year-old. And so and a husband, and they all keep me busy. And I do sleep, Paul, because that's important for our ecosystem. But I will
Happy to
tell
hear
you,
that.
the juggling is challenging at times, for sure. And there's no such thing as balance. There's always going to be a little bit more time sometimes spent on work, and then some days will be more time spent on family. And choosing that shifting balance and being okay that it's going to be like that, and having a supportive mate that actually supports those things, and me pursuing all those avenues is really key. So Drive PT, again, is intentionally part-time so that I can keep those all afloat, and be able to deliver care that I want to, and in a really individualized way. So it's one-on-one for an hour, and I see patients Tuesday, Thursdays. And so those are kind of like my time blocks, and I try not to go outside of them. Sometimes I will for more acute injuries, but I try to respect that time for my family, and then just for running South and then ice. And I mainly see CrossFitters just because I'm right in the box. But I also see their family and friends. I see neighbors. I see people from church. So I do see a variety of patients in all ages, not just CrossFitters. I also see a lot of chronic pain. So that's kind of Drive PT in a nutshell. I know that you also asked, what would I tell someone or rehab professional thinking about, doing this model? I would tell you that it's awesome. It allows you to be autonomous, but it's a ton of work to manage the business side of things. And so you need to be very mindful of schedule blocking for business practices like advertising, doing notes, even cleaning the office, the not so glamorous part of a business owner, especially when you're the sole provider of those things. And so it always takes more time than you think. And that's been an on-off, up and down struggle for me to learn, sometimes the hard way. But I'm finally, I think, in a good place where I'm learning that if I have the time blocked to do something business related, don't give it up to get a patient in the early phases. Doing that to get people in the door is sometimes necessary, but you'll really do that you'll sacrifice your own sanity if you continue to do that. So you have to stick to your schedule and not deviate.
Yeah, even as you describe all that, without giving my whole story, like we had brick and mortar cash pay clinic, so 40 hours a week in the past. At this point, I'm similar to you. I actually just have a roster of 10 clients, and I see them
Beautiful
when I can. It's very challenging. I mean, both setups right now. I think back to when I was like, okay, here are my hours, Monday to Thursday. I kept Friday open so I could travel and teach. But yeah, that weekend you're home, that patient really only can come in Saturday. It's very tempting as a business owner or just an individual, and our little physical therapy Peace Corps gene of we'll sacrifice our physical health to help you, basically. Those boundaries are important. And shout out to all the families, the husbands and wives, because yeah, it's not something you can do on your own. And I'm not saying in the business aspect, I'm just saying like that support system is one of the primary things that got me through it. I mean, I'm even talking like physical and mental health of the exhaustion and just the frustrations, the challenges that come along with it. But I think you said it very well. And if balance isn't possible, then boundaries have to be.
Yes, for sure. There's no perfect balance, but those boundaries are key for your mental, emotional, and spiritual health for sure. And you can't do it without that support system.
Yes. We are almost out of time, so I'm going to give you two more questions.
All right.
First of all, I'm going to allude to a previous conversation that I don't think I've mentioned yet. You and I have had brief discussions about this endorsement of movement specialists. Like you graduate physical at your DPT, the profession of physical therapy means we are movement specialists. And while I fully believe that is how we're positioned and that's how our education is designed, I think what prompted this conversation is it might have been on that interview with Jeff Moore.
Yes.
Is I just came out and said, we're not movement specialists. There's a gap there that you have to. And I was looking internally. When I graduated, I was not a movement specialist. Like I loved that endorsement. I loved that that's why people came to see me, but I was not equipped to be a movement specialist. So not to put words in your mouth, but if we're to continue this conversation, how would you expound on that? And if there is a gap, how do you see us closing it?
So Paul, that episode was really powerful to me, that earlier episode that you did with Jeff Moore, and your words actually really resonated with me when you said that it truly is an earned expertise, right? You need to take the time to be a movement expert, which means you have to be moving yourself. You have to take the time to watch others move. You have to explore different movements. And, if CrossFit's your thing, you have to get outside of CrossFit too. You have to explore maybe paddleboarding or rock climbing, and be very versatile in your movement library yourself so that you're willing to expound and grow your patient's movement library and not putting your own personal narrative that on them. So I think often we as therapists have the potential to restrict our patient and their ability if our movement library is shallow. And so really working on your own personal resilience. And it doesn't have to be CrossFit. Of course, I'm biased for that. That's what changed my practice. I've almost been CrossFitting 6 years, and I've seen my patient treatment and them achieve their goals faster through invigorating my plan of care with multi-segmental functional movements. I see that consistently. And I think all PTs should be doing that. They should be well-versed in the deadlift, the squat, the hip hinge, carries, overhead carries, suitcase carries. And I believe that so wholeheartedly that that's what our South DP2 students are learning in advanced interventions, how to look at those movements, how to coach them, and not being afraid to lift something heavy, either from the ground or overhead. And so that's kind of my little spiel on that. I think there was a second part of the question that I missed.
I think you answered. I mean, I asked if there's a gap, how you fill it, but I think I like the word movement library, first of all. And that's not just like watching videos on the screen. It's like experiential, like you said, getting outside of, even if you do have this hobby or this passion, getting outside of your silo. Because I will say part of it just seems like on the business side of speaking the language. And I'm thinking again, back to my own practice, I saw jujitsu, I saw triathletes. I can't speak the language to any of that. And I've never experienced any of that. And you see that even if if they buy into your treatment model, or it's a high endorsement that brought them into your doors, so they're willing to stick with it, you do see that there's this slight disconnect. Or if you want to talk more positively, there's a very definite connection. You were with CrossFitters, but there's other PTs out there. Last week we had Lindsey Becker, who's a golf specialist. The week before that, we had TK Mosier, who works only with MMA fighters, and she's a Muay Thai fighter. There's a very definite, real connection you have when you can say you do this or you've experienced it.
Yeah, I totally agree with that. And I would say those patients that you're going to attract, they do want to see you doing that movement, or at least taking effort to learn about that movement, right? If you're starting to see a lot of people at jujitsu, go to the jujitsu and watch, learn it, take a class or two. And I challenge my students to do that as well. It's not okay if you're seeing a swimmer and you don't learn and study swimming. It's not okay even if you've never played baseball in your life, that you don't learn the stages of throwing and take that time to learn it so you can treat your patient well. And if you don't feel like you're at that level, then refer them to someone that has that great experience, because it's not about us. It's about getting that patient better.
Love that. we are way past time. So I first apologize. I hope you're good.
We knew this was going to happen, Paul.
Yeah, the egg timer never went off. Last one, it's really an open-ended question. Like, I would definitely consider you, based on your resume, but everything you're doing education-wise, private pay practice-wise, I would consider you an influencer, a role model out there in our profession. So to the listeners out there, give us a soundbite, give us a 1 or 2 sentence or more, but a piece of advice. And it's a piece of advice you would have given your younger self, or maybe something you're seeing as a common pitfall that, again, maybe you experienced yourself. Just give us the closing comment here.
Well, thank you for that high compliment about the role model or influencer. I feel the same about you, Paul. So I would say be unabashedly you. So what you bring to the table has great and unique value as a professional. Don't try to emulate another human. Learn from that human, right? But bring your unique genius to the table. And I made the mistake of really trying to mimic a lot of my mentors that I loved and valued. And I think in some ways this set me back. And ever since I joined ICE Physio a year and a half ago, I mean, this tribe has really pushed me to be me and to really lean into who I am. Specifically, our leader, Dr. Jeff Moore, has really challenged me to do that. And what I bring to the table is unique. And I think leaning into that has made me a better teacher, human, and mama, and clinician. And so be unabashedly you in your pursuit of being a physical therapist.
I love that. That's the bumper sticker. Be unabashedly you. And then it'll say at LT Hughey on Instagram. But I love that. And you actually infused a few others in there too. I mean, surrounding yourself, the tribe, it's a real thing. And it infuses, even if your initial intent is entirely professional development, it trickles down into every other aspect. Again, I called it the Peace Corps gene earlier, but physical therapists, or let's just say rehab professionals in general, were cut from a very distinct cloth, whether we want to admit that or not. And what that means is what we do professionally affects every part of our life. That's family, that's our personal fitness. Like you mentioned, mental health, spiritual health. I mean, we are not the best containers as far as just keeping everything so separate. So really consider it professional advice, consider it personal advice, but the endorsement to be unabashedly you. I think that's the best way to summarize, to conclude, cap off this episode.
Thanks, Paul. Thanks for listening, everyone.
Yeah. So we do have a few more episodes coming for this little, I don't even call it summer segment. We're going to have 8 total episodes. Every Wednesday it'll drop. You can catch, if you'd like to see our faces, if you're watching on YouTube, I'm very red today because I got out in the sun this weekend.
Nice.
So sunburn and my Irish complexion, this is what happens. So YouTube, you can actually catch the video. Otherwise, like I mentioned, we are on Spotify, iTunes. If you're just jumping on the link at our profile, it'll take you over to our Anchor platform, which can funnel you to any of those other ones. But we will keep dropping episodes every Wednesday at noon Central. Again, just to funnel you towards our guest and some of the stuff we mentioned, at LT Hughey, Hughey is her last name, or at South College DPT, at ICE Physio is what we keep mentioning for ICE, the Continuing Ed, Institute of Clinical Excellence. Otherwise, you can send us a message on any of the socials, or you can directly reach out to Lindsey, because she's the kind of person that will respond promptly and thoroughly. So thank you for your time, Lindsey. Thanks for listening, everybody. We'll catch you next time.
Thank you.